Good morning, everyone. Today is a peaceful, it's a beautiful morning to actually just wake up and go somewhere and try to push for one or two things. But I believe that most of us are confined to our homes, to our bedrooms, and all that because of the coronavirus, which has devastated many countries. Zambia is not spared. I still believe that as a country we can win this fight against this deadly pandemic. I know that the government of the day is actually trying by all means to fight this disease. So many measures have been announced. So many things are being done in different provinces of the country and all that. But the point of making this video this morning actually is just to try to talk about the some of the impacts of this virus on the of this disease on the economy actually, uh, both on the local economy and also the world economy. I know that most countries, we live in a global economy where one country is depending on another, and just like that, those we have countries that do the manufacturing, and then we have those countries that actually are involved in the assembly of different products. So if one country is not producing per se, this will affect another country in terms of their their exports, and also in terms of their import. So Zambia as a country, actually, we have also been affected. We know that South Africa supplies most of the goods that we use in our country, and we know that the borders of South Africa have been closed, and quite a few number of industries have been closed, and people are working from home and all that. So this has actually affected our country, our economy, because we are actually losing out in terms of those taxes, in terms of collections at the border, and all that. So this has actually put our government in a lot of pressure in trying to mobilize resources. Uh, you know that as a country, most of our teachers, our doctors, all these civil servants, bankers, what that work in different ministries depend on these collections. And once the collections are affected, this will have an effect on how much the government actually is raising. So this is quite a complex situation where people have to eat, people have to get out and try to make something. But again, there is this disease out there, and we have heard from government that it's not possible for a country like Zambia to go on total lockdown, because our people will die. Our people will not afford to even have a meal in a day, because most of our people are actually in the informal sector, where they depend on their daily daily business or daily trade to feed their families. So this actually is quite a complex situation. And then on the other hand, we are saying the spread of the disease must be contained. People must stay in their homes, people must mask up and all that. So I would like to put the onus of the in terms of spreading the disease on us as individuals, to say, let's try to protect ourselves, and also let's follow what government is telling us in terms of staying home, avoiding unnecessary movements, and also washing of those hands. And I know that I heard a pronouncement where the Minister of Home Affairs actually have warned to say if you are found not wearing a mask, you'll be prosecuted, and you don't want to be found in such a scenario over a mask which is costing five kwacha. I'm sure I know we are we're a poor country, but I know that at least someone can afford a five kwacha. If not, we can make our own masks just by you can sew. Our people are talented. Our people do a lot of things, so they can sew these masks for themselves and for their children. Otherwise, at the moment, we just have to protect ourselves and make sure that even as we go out there to to try to earn a living, we we protect ourselves by following these measures that have been put across. We can't afford to lose a lot of people like many countries are doing. Neither can we afford to escalate the number of cases, knowing that this puts pressure actually on our resources in terms of trying to provide for these masks, I mean cleaning chemicals and all that. All these things require money. I know that there are a lot of donations that have come in, and I know that the Minister of Health is actually managing those resources. But I know that those resources may not be enough if the numbers were to escalate from what we have now. So we need to make sure that we act responsible as citizens of this country, and also we make sure that we adhere to the measures that have been put across. Otherwise, this is my message for this morning. Enjoy your morning.